Well, in response to that report, a spokesperson for South London and Maudsley NHS Foundation Trust told Channel 4 News that it is strongly committed to understanding the social and economic factors that impact upon black and minority ethnic communities and are providing services that are more responsive to their needs. Well, joining me now is Jackie Dyer, co-founder of Black Thrive, a partnership for black well-being, and Roger Smith of the Nubian Users Forum, a group that supports minorities with mental health needs. Let's talk about solutions for a few minutes, because that film laid out the problem very, very clearly. Sure. How do you make a health service that is predominantly white and Asian, in terms of the people delivering the service, sensitive and accessible for black men?
Well, first and foremost, let me just address that by saying that it's one of the most difficult tasks to actually do, because you've got a predominantly, as you said, a white area, and we're always in a minority. And secondly, as a black person, as you saw from your own film, you'll see that you're going to be marginalised and disenfranchised straight away. You don't have to say anything or do anything. Your complexion just says it all, and straight away they look at you as being the aggressor.
So how do you take away fear of the black man?
So the way you take away the fear is basically you have to empower them and let them know that, like, that's not the only way forward for them to be heavily medicated. You have to make sure that the system like social services doesn't allow anybody to actually be put back into the system like through roving doors and go back into hospital. They have to stay with their extended families, not go into foster care from when they're young and things like that, or get involved in any sort of gangs or anything like that.
Are there any examples of what works? How you make the system more sensitive?
I think that you have to look at the system as a whole. This is a systemic issue of unconscious bias and racism in terms of attitudes that manifest themselves in behaviour. And then you have to make sure that in each of these different arenas that are making decisions about what would best respond to black people in mental health crisis, that black people are actually involved in that process. So there are good examples of that kind of work taking place, having a systematic response to a systemic issue. In Lambeth, we are working both in terms of Black Thrive, working with system leaders from the police, from health, from education, from the leaders of the council, working with community leaders, community members, carers, service users, and people who are interested in this agenda, working in an equitable way to address and look at what are the solutions that are around prevention, what are the solutions that improve access, what are the solutions that improve the patient experience. So there are ways that we are doing that, and we're doing that working in collaboration, co-production, and partnership. It can be done.
I mean, we heard in the film that gentleman saying, you know, black people don't go for mental health help early because their attitude is if you go into the system, you die. I mean, how do you change that perception? How do you get people seeking help?
Well, it's one of the most hardest things to do, once again, because they have lack of confidence in the police and in the system, because if you already have a stigma attached to you and a label, the only way you can combat that is to literally is to try and unite and say, well, if you have your own journeys and you try to get people into some kind of centre or whatever, if there is one, unfortunately there's lack of these centres. With the cuts and then what the things the government is doing, they have a very hard place to actually go to and actually do stuff about getting their support.
But are you saying black people don't go to their GP and say, I'm feeling terrible?
Even if they do go to their GP.
Even if they do go to their GP, I am saying exactly that, because the GP doesn't even really understand the prognosis. They're very quick to sort of just give you just some medication, but they don't really understand the demographics, because they don't suffer through mental health themselves too much, really. So
I think it's a different experience. The experience of African and Caribbean people within this country, as demonstrated by the Race Disparity Unit, is data, ethnicity figures, is that when you look right across the public sector, employment, housing, education, health, criminal justice system, our experience is one of being discriminated against that manifests in detention or exclusions. Our experience, and this is for decades and beyond decades, because it's over hundreds of years, there's this dynamic of oppression that we experience. How can one expect any other manifestation other than crisis within our communities? Because what you have is system players that keep replicating.
But it needs to come from both ends, doesn't it?
But it needs to, in order to make those changes, you have to work with the people that are being oppressed, but the oppressors also need to work with those oppressed much more closely than ever they do. Normally the response is, oh, we've got a crisis, so let's look at the top-down answer, we can drop down on the people here. Actually, that does no longer work. You have to work together all along the way in a systematic kind of a way and have the very difficult and absolutely quite frank conversations about how discrimination is undermining our ability to have good mental health and well-being in this country.
For decades, it's been a taboo subject, and in some communities, it still is. If you're a black man in Britain, you're 17 times more likely to be diagnosed with a serious mental health condition than if you're white. It's a startling statistic, and it led blogger and DJ Keith Dubé to make a film for the BBC to investigate why.
I was diagnosed with depression a few years ago. It was the hollow feeling of worthlessness a lot of the time. It was a horrible experience. It was very confusing because black people don't really do mental illness, so it's not something you grow up hearing a lot about. I think my lowest point was when I was continually waking up thinking, I don't want to live anymore.
For over 2 years, I didn't utter a single word about my depression to anyone. I was too ashamed. But then, I decided to out myself.
I wrote a blog, closed my laptop, and I went to sleep. So I've woken up a couple of hours later, and yeah, I had a crazy amount of messages from people. All of the messages were positive. And I also did realize that there were a lot of people just like me that were going through the exact same things I was.
One message in particular has caught my eye. It's from a 20-year-old uni student from Surrey called Simone.
So when did you first kind of feel like something wasn't right?
I think one time in year 10, there was a week where I just started having breakdowns. I remember there was one time when I just started crying randomly during break time. I realised there was something wrong.
So at any point, did you speak to your parents about?
I felt like if I was to tell my parents, they would just kind of brush over it and not kind of find out the root of the problem.
Do you feel like there's a stigma surrounding mental health, you know?
With parents, especially African parents, they don't have enough knowledge about it, especially the ones that were born and raised in Africa, like my parents were born and raised in Congo. I think I'm ready to see a doctor and finally get all like checked out.
Ati! 逃したか。